My grandpa started taking some medicine for his high blood pressure. He's complaining of fatigue and diffuse muscle weakness. His electrocardiogram results show peak T waves and a wide QRS complex. What do you think is wrong?
Do you know what medication he was given?
No, I am not sure of the name of the drug. Do you know of any blood pressure medications that might cause these side effects?
It sounds like he might be on captopril for his high blood pressure.
What does that do?
Angiotensin-converting enzyme inhibitors such as captopril block the conversion of angiotensin 1 to angiotensin 2. Normally, angiotensin 2 acts on the adrenal cortex to secrete aldosterone, which in turn acts by increasing reabsorption of sodium and secretion of potassium in the collecting tubule. Because less angiotensin 2 and aldosterone are being produced, sodium and fluid volume are being lost.
Why would that cause symptoms of fatigue, diffuse muscle weakness, and peak T waves and wide QRS complex on an electrocardiogram?
These are all symptoms of hyperkalemia. The lack of aldosterone results in potassium retention. Hyperkalemia is a rare occurrence in patients on ACE inhibitors without underlying kidney dysfunction. In the geriatric population, kidney function is decreased as a natural physiological part of the aging process. Due to this decreased kidney function, elderly patients are at increased risk for developing electrolyte imbalances. Specifically, hyperkalemia is a common electrolyte imbalance seen in older patients. For this reason, drugs that cause hyperkalemia should be closely monitored in the management of geriatric patients.
Is it possible that these side effects could be from furosemide? That's another drug that's often prescribed for high blood pressure.
Furosemide is a loop diuretic, one of the most powerful diuretics available and can be effective for high blood pressure treatment. In contrast to captopril, furosemide tends to cause hypokalemia. It acts on the thick ascending limb of the loop of Henle that functions by inhibiting the sodium potassium chloride symporter, and is known to cause hypokalemia by the loss of hydrogen and potassium ions.
Would hydrochlorothiazide be a possibility?
Hydrochlorothiazide is another type of diuretic, known as a thiazide. This drug also tends to cause hypokalemia. It acts on the distal convoluted tubule and functions by blocking the sodium chloride cotransport system. This causes the loss of sodium and chloride, hence water follows. Thiazide diuretics are the drug of choice in the treatment of uncomplicated hypertension. They are known to cause hypokalemia like loop diuretics, but at a lower level.
What about metoprolol?
Metoprolol would also favor potassium excretion. Metoprolol is a beta-1 selective beta blocker. A non-selective beta blocker would contribute to hyperkalemia by inhibiting the beta-2 adrenergic receptor that increases cyclic AMP and activates the sodium-potassium fist pump. However, metoprolol is only active on the beta-1 receptors in the heart. The physiological effect is a decreased cardiac output due to blocked sympathetic input. This causes decreased blood pressure and reflex activation of the renin-angiotensin-aldosterone system by the kidney. Increased aldosterone activity favors potassium excretion.
What about nifedipine?
Nifedipine favors potassium excretion as well. Nifedipine is a dihydropyridine calcium channel blocker. It blocks calcium channels in arteries and not the heart. The decrease of intracellular calcium in the smooth muscle cells of the arteries leads to relaxation and vasodilatation. The resulting drop in blood pressure will activate the renin-angiotensin-aldosterone system, and aldosterone activity will favor potassium excretion. It is important to note that the decreased blood pressure will also cause reflex tachycardia in the heart as its muscle calcium channels are not blocked by nifedipine.
Okay, thanks. It looks like my grandpa may need to be switched to one of these other blood pressure medications to avoid the side effects he is having. Let's get back to this tennis game.